first speaker for today. We have Anita Granero, founder and president of the charities Oscar's Angels and Oscar's Angels Italia. And Anita has basically founded this foundation, this Oscar's Angel, to support teenagers and children who are impacted by brain tumors. They do this through a network of volunteers that they train, and basically they work to support these families and patients in the heart of the hospital, and have a very specialized volunteer program to do this. I'd like to share that Anita will be talking specifically about specialized volunteers in the heart of the hospital from a pediatric neuro-oncology point of view and from a pediatric care point of view. I'll give it to you, Anita, to start.
Much, and thank you first of all for inviting us here. And what you're gonna hear about is something that we invented, if you want, this new member of the multidisciplinary teams. But it's something that can be done anywhere. In our histories in pediatrics, but you will see that you can adapt that anywhere you are. So please, the next slide. Okay, these are just our t-shirts. As you say, this is the Italian t-shirts. A volontario is one of the members of the team, is the volunteer. Next slide, please. So that's a new member of the multidisciplinary team. Yeah, that it was prepared by one of the children. So you can see the slides are very interactive. Next slide, please. The timeline is this. Just keep going, Kamal. That's it. We were created in 1998 in France at the Hôpital de Toulouse, l'Hôpital des Enfants de Toulouse. And we have been working forever with Italy, of course, to support also Italian families, not with the volunteers in the hospitals, because I physically was in France, but with all the networking, advocacy. And it was in 2018 that the hospital in Rome, the Bambino Gesù Hospital, asked us I met them during a congress, and they asked us to think about training volunteers for them as well, because they really wanted to have that kind of help. And so that's what we did. We created the Oscar's Angels Italia in 2018, and we started immediately at the hospital Bambino Gesù. And now we also have another program of volunteers going into the pediatric hospital in Turin, which is another very big hospital in Italy. And that is, I have to thank Professor Franca Fagioli, which is the director of the children department, for her insight and for really believing in our program. So we will start that. Probably we already are there with the financial help or the support that we give the families. We are not there with the volunteers yet, because they are not still open for new volunteers because, of course, the COVID problems. But we carried on working anyway in France and in Rome, because we already had volunteers there. Next slide, please. These are our pediatric expertise. That's what we are trained for. That's what we are following. The CNS tumors, of course, with a particular focus on very rare brain tumors, the IPG and the ATIT. Of course, bear in mind that here we are talking about pediatrics, okay? We follow also all the neurosurgery, the severe head traumas, the pediatric palliative care, the quality of life, and also in the ICUs where we are present, we take care of the cases of anoxia and severe burns. So as you can see, these are very heavy situations that we have to deal with in supporting the families. Next slide, please. These specialized volunteers, like we like to call it, so the actually hospital likes to call it, is really a link between the health team and the family. That's what we are, and we give human, spiritual, and financial support, which is very important as well. And you will see afterwards in what manner. Next slide, please. We are, as I said, in France, first of all, at the Hôpital des Enfants de Toulouse, in Rome, in Turin, and in Monza. These are the first 4 places. In Monza, we just give an external support. We don't have volunteers inside. We have them in Turin. We will have them, and in Rome. Next slide, please. Who is the specialized volunteers? We said is a new member of the multidisciplinary team, and what it is more important to understand that it is a constant throughout the patient journey. That is what they needed, and we specialize especially specialize in neuro-oncology because of the pathway of the patients, because the patient doesn't just stay in one of the wards. The patients go through surgery and then the ward of neurosurgery, but then he goes down to the operation theater, then he goes to the ICU, then he goes to oncology for treatment, and then he goes to the radiology. So he just navigates. And what we do is that we navigate with them, and it keeps that constant presence of somebody that they actually need, know, and trust. And we have a system now in France that starts from scratch, from the emergency department. As soon as they arrive, we are present there. Next slide, please. So here are just some pictures going on. Just keep going, and you will see some pictures of the volunteers that we have, and the fact that we actually allow the parents to go down with the children to the operation theater, and that is because the charity coordinates everything, and the teams, the operation theater teams are comfortable enough to allow one of the parents inside for anesthesia. Keep going. Next slide, please. These are some of our really striking innovations. So the volunteers are members of the hospital teams, 100%. They are considered members of the team. The team shares information with us, like that they don't share with other volunteers, classic, I would say, volunteers, which are extremely important, of course, but I have a different focus. Our focus is not really the children. Our focus are the families, and we are the link between the teams and the families. Another thing that we put on the hospital in Toulouse is the on-call volunteer. So we have now a volunteer or a couple of volunteers that are on call nights and weekends, and they can be called by the ICU or by the neurosurgery operation theater if there is one child that arrives for an emergency surgery, so that the family is not alone, which was the case and is still the case in many hospitals, the lack of support at the moments where they needed it the most. So we filled that in. And another specialized volunteer is another specialized team of our volunteers are on call and available 24/7 for the palliative care and end-of-life care of the children in hospital. Next slide, please. This is what we were saying before, the pediatric patient path care way. For what concerns our charity, we are really based in neuroscience. Everything that touches neuroscience, so neuro-oncology, neurology, neurosurgery, and the ICU, going till the end, till the palliative care, and till the end of life, because that is part of the life of some of our children. So we had to specialize in that to be able to be with them right till the end, if that was the case. Next slide. This is just who we are. is just, as you can see, 100% member of the team, where you have all the other characters of the movie, and we just one of them in addition, one more. Next slide, please. The other value, actually, I asked the medical team to do it, both the one in Rome and the one in Toulouse, and that's what it came out with. And I think it's just spot on. It's the daily constant presence that we are, the role of mediator, which is a mediator that is there daily. So things don't get too stressed. When there is a problem, we are there too. We talk to the family in a different way, with different words, and things just, the pressure goes down very easily. We have an active listening, of course, a present in emergency, a different perspective that we can bring, not to the family there, but to the team. And that was the most important thing they said. They have another view of what's going on in the family. Better information, because we just vulgarize on and on and on, or whatever information is given, and of course we have the time to do that, which is very important, and that creates an improvement of the patients' and families' quality of life. But I would say also the quality of the work of the teams in the hospital. Next slide, please. How can we do that? First of all, you have to have the will, the collaboration of the healthcare professional, of course, otherwise you go nowhere. You have to have the trust. You have to have an absolutely rigorous selection and training of your volunteers, and you have to have the family support that allows you to just get into their lives at that moment, the very difficult times, and allow you to help them. Next slide, please. That is something that is done, as we said, with a very rigorous training. That is our training. That you have, you can see, you have different level of selection, going from the first phone call, the interview with me as a president. Then they begin training, and the training goes from 6 months to 1 year in the hospital as tutoring training. Then they have the psychology evaluation, and the final evaluation, you can see, is done not just by the charity, even if it's the charity that takes the decision, but is done with the senior volunteers, with the psychologists, of course, but with the medical teams as well, because this person is going to be a member of that team, and they have to feel absolutely comfortable with it. The selected volunteers then do start to what we call them being senior volunteers or tutors, and they can at themselves train other new volunteers. Next slide, please. This is the practical, if you want, training, but we have a theoretical training as well. These are what we call the modules. They have 10 modules they have to follow during their training, and you can see they are very specific, they are very pathology oriented, because they have to have knowledge of what they are going to face, or they have to have knowledge of what the families have to face to be able to help them and to be able to understand what the families say. They have to have these informations, and these modules are done by the same doctors of the hospitals that participate, as you can see, really deeply into the training of our volunteers. Next slide, please. We might not forget the advocacy, of course, because our charity is also a charity of advocacy, of trying to bring the voice of the families and the patients as well outside the hospital, and trying to get the best possible treatment for them. Now, we do advocacy on a higher level, on a national level, on an international level. What we managed to do with Oscar's Angels France and Oscar's Angels Italia is to put an advocate right in the hospital, right at the lowest level of the advocacy, which means the wards right next to the patients and the families, not just the commissions and then the direction of the hospital, but right there, bringing the voice of the families on a daily basis. Next slide, please. Now, this is the advocacy in the health sector. Kathy Oliver of the IBTA spoke very well about it, so you don't need me to go on with that. So next slide. And we do our part of the IBTA, which it brought us extremely a great knowledge of what was going on the international level for what advocacy is concerned, because I think that the kind of charities we are need to have a grasp on what's going on an international level, not even just on a national level, but international, to be able to help our countries as well to improve their representation of patients and families. So we are members of all these Italian and French advocacy groups, which is wonderful. Then the next slide is the one that just shows through the IBTA, the members. We are members also of these groups. Next slide, please. And why is it great? Just click once more, because it's zero cost. That is the key. You know, we do not cost anything to the families, of course, and to the hospital as well. And that is the most important thing. That it means is society that brings the efforts together and say, okay, we are close to this charity and we help this family inside in training, with the training cost and with the financial help that we give for emergency to the families. Next slide. So I'm just thanking you all very much. I hope I didn't take too much of your time, and I try to talk as fast as I can, but being Italian, it's easy. Thank you very much.
Thank you so much, Anita. This is actually incredible, just listening to you, that these highly trained volunteers are in fact part of the healthcare team, and they're considered to be part of the hospital care that the patient receives. And in my mind, I'm thinking that they represent the family. They're probably able to bring a very different perspective and bring that perspective of to the healthcare staff of the emotional stress and needs of the family, which are probably not on the medical side. So I think this is actually quite phenomenal, the work you're doing. Thank you for sharing it with us today.